back to Wellbeing Wednesdays. So happy that you're joining us again. I am Shauna Foose, one of the therapists at Tulane's Counseling Center, joined by my co-host, as always.
I'm Dr. Janaki Flint, and we are joined today by Dr. Commodore, who is the Medical Director of Campus Health. Welcome to Wellbeing Wednesdays, Dr. Commodore. We are so happy to have you today.
Thank you. It's a pleasure. I've heard that this is the highest ranking on the internet, so it is. I feel very honored to be here.
Yes.
Good to have you. Well, we wanted to spend some time on today's episode talking about COVID-19 and the way it's impacting our community, the Tulane community. So maybe just give us a little bit of an overview of how from your perspective, things are going.
That's such a loaded question. You know, I was expecting more of a softball to get me.
Like boom.
So I think that COVID is on our campus, right? There's no denying that. I think that the university is trying to be as transparent about it as possible. I would say that after sort of the initial couple of weeks of more cases than we're comfortable, we've settled back down into a pattern of a background rate of maybe 1% and 3%. So, so maybe I get 2 or 3 positives every day. Not all of those are students. Some are faculty, some are staff. So we're testing everyone here on campus. And so, but I would say that it certainly feels less frenetic. It feels like there is less activity in terms of COVID cases. That doesn't mean that people aren't concerned about it, that people aren't worried about it, that it isn't impacting people's behavior. Frankly, that's kind of what we want, to impact people's behavior and so that they can be the best version of themselves. We're all trying to be good citizens towards each other. But I would say that from I think we are in a bit of a better place.
Awesome. Yeah, well, that's encouraging.
Mm-hmm. So I'm encouraged too.
Yeah, thank you. One of the things that we often are dealing with too is the isolation and the stress that comes with feeling isolated from students who have to go to quarantine and what that may feel like for them. Is that something that you have kind of have seen in your work as well?
Oh, most certainly. It's palpable that students they don't want to be isolated. They don't want to quarantine. They know they must. They want to know if they are infected. They want to not endanger their friends and their loved ones. So I have actually been quite proud of our students who try to be proactive. They want to do the right thing, even though they know that the right thing might be uncomfortable for them. I think we definitely have, we have a new behavioral health counselor here at Campus Health who's been helping us particularly with outreach to our students who are in quarantine and in isolation. While the vast majority of students are managing okay, it is still an unnatural situation. To be in a room by yourself, to not have your normal social outlets, to not be able to socialize with folks, to not be able to walk around, to not be able to go out and get fresh air. These are natural, normal human needs. And for a period of time, they're not available to you. So it is definitely something our students are dealing with.
Yeah, it goes against so much of our natural instinct. And also, I think when we're not feeling well or feeling frightened in any way, we tend to want to move toward each other and kind of hold on to each other. And we're in this forced isolation. Even if we're not sick, we're all still practicing social distancing and being cautious about how many people are gathering together and things like that.
Yeah, I'm aware, I can explain. So you talk about even if you're not sick, if I might dwell on that population for a second, if the people who are positive, as bothersome as that is, it is an easier sell, if you will, to say you have to be by yourself. But the close contacts, right? The people who they have to quarantine as well, even if they have negative tests, so on and so forth. And I can talk till I'm blue in the face about incubation biology, right? Like, and I saw everyone's eyes glaze over as I even said the word, right? I can talk till I'm blue in the face about that, but in the end, it goes against one's natural thinking, like,
yes.
Why am I having to be at the house? I don't have an illness. I'm not sick, right? Mm-hmm. So there are solid reasons for the quarantine, but I recognize how counterintuitive it feels to be told that you have to be in place in a building, in a hotel, in whatever place, but you don't have any quote unquote proof of illness.
Especially in this developmental stage of emerging adulthood.
Oh, yeah.
That is like a huge piece because everything is about either self-appraisal or appraisal of others.
Correct.
Being able to be connected as human beings. Like you said, we're hardwired for connectivity anyway. It's kind of like, it's actually a neurological piece.
Right.
So the whole biology, I totally get.
Right.
But it is hard. It is difficult.
And so, you often get into, negotiation, well, this, could I get this? Or yes. If I did that, could I have this? And, sometimes my job feels like all I do is take the cookies away. Like that's all I do every single day. And this is not to make it about me. Mm-hmm. I want to be clear about that. I feel like I'm always just a bearer of bad news. It's a responsibility I accept and I take very seriously. I don't understate how that feels for the recipients of the information, for our students who, they want to see their friends, they want to go to class, they want to have Wi-Fi that works, they want to have, they want to be able to get their Amazon packages, they want to be able to do all of these things with the freedom to which they have become accustomed, and so that is difficult.
Yeah, it is. And that's why we're here. We ask students all the time. We talk to our campus partners. We're doing a lot of seminars out into the community. We're doing Wellbeing Wednesdays, bringing folks like you on to let students know that, we're going to be talking about some typical reactions to this, as well as some strategies for how to manage through this time. Because you're right, there's a lot of frustration. You mentioned earlier before we started about frustration and tolerance. And I'd like for you to repeat that part, because I think that's really important to let students know that we see.
I think, I wish you hadn't used the word frustration and tolerance, because now I have to unpack that, right? Because that's a term of art, it's like, ixnay, but
well, it's learning distress tolerance and frustration tolerance.
Right. It's a term,
something in our field that we do every day.
Right. It's a term that simply refers to the fact that at various times in our lives, situational, but some of it is actually just age-related, harder to deal with frustration than it might otherwise be. And it is particularly hard to deal with frustration if it is imposed upon you rather than something that is a consequence of an action that you made. So to wit, we test students every week. Students want to know that whether or not they're positive or negative. They dutifully go, they check, they do their test, and then it's positive, right? Which triggers a whole number of sort of instantaneous responses. And it's responses that are frankly out of awareness. It is fear, it is worry, it is guilt. Did I expose my friends? What about the people I hung out with last night? What about my, did I do something to them? Will they blame me for the fact that they are going to spend all of this time? And so that happens like that. I mean, that happens in the 10 seconds before, in 10 seconds before we at Campus Health or our contact tracers ever get a chance to reach out to a student. So it starts in early, and then we put people in a place that wasn't what they signed up for 10 days, for 14 days. Sometimes even worse, while they are in quarantine, they come into contact with another person who is positive, so that their quarantine is even further. And that feels so unfair. It feels like the universe has descended upon and decided to torment you. And so it's a natural feeling. It's a natural feeling.
Very common, very natural.
It is common, it is normal. And so I guess that's the thing that I want students to know, that they're feeling that way. It's normal.
This is really difficult.
Really.
It is.
It's the hardest thing they'll ever witness. Probably many students. It's and it's so pervasive as well. So
and it's within living memory for many of them. Last year, they were able to have a normal life. This year, they can't, right? And so these frustrations are normal and natural, and sometimes difficult to tolerate. If you're a student who's come to our campus with any kind of mental health history, this can definitely be a trigger for that kind of history. Students who may have had no firm diagnosis, but you were able to manage things, this kind of experience can exacerbate that. And we know that. Others, they are frustrated, but manage the time well. Now, for those first couple of groups, we definitely want to hear from them. I'm sure we, meaning us at campus, we meaning those at the counseling center. So we all want to hear from our students. And I like to say, no problem too small. Right. So if you're frustrated, reach out to us. We'd rather say, well, it sounds like you've got this under control, than you never reach out to us. But we recognize, at least I recognize, that within this whole framework of trying to keep everyone safe, just because you're doing the right thing doesn't mean it feels good. So they're like,
yeah. And oftentimes when you talk about what the body is doing, sometimes the body is quicker than us, right? So it operates in split-second timing. And so unless you get the kind of, unless you're actively kind of looking to us and sitting in a space where you can be cared for and learn some strategies for how to create a container for yourself and to use your body as its own resource, sometimes that can actually make you feel like, what's wrong with me? What is happening to me? When you're feeling that guilt, that sadness, that frustration, that worry, that incessant worry, right? That most people will say, oh, you're just anxious, but this is a natural anxiety, right? And so it's hard to separate then who you are from what's happening to you.
Yeah.
And that can be in and of itself stressful.
I've talked with students who had a positive test and were largely not symptomatic, but then began to experience shortness of breath. And they said to me, I don't know if this is COVID or if I'm having a panic attack. And I have said, well, I don't know either, but I know some strategies that help with shortness of breath that we can do together And we don't have to know if, you know, obviously if it needs medical attention, we can do that. But that sometimes, you know, just being able to calm down and tune in a little bit can help to figure that out, right? Is this the physical side of the virus, or am I really just feeling that heightened anxiety that can impact the breathing? So certainly.
And I think for us too, it's always to know, one of the things that I keep top of my mind is that sometimes students, this is all going to happen, and that the naturalness of this, and that sometimes we can do what we can do to help students create that container, but sometimes we also have to sit with the students' frustration and guilt and worry, and know that it's natural, and communicate that with the student, that this is natural process that your body is taking. You know, the body is here to keep us safe, right? And so what we're dealing with is telling the body at all times, guess what, we're not safe. So the body's engaging in processes that is really difficult for the student to bear. So the basic thing that for me is to, sometimes I just have to bear witness to what's happening.
And it's not just that the body is telling us we're not safe. It's dealing with that since March.
Yes.
Most of it's a sustained, unrelenting, you know, even the parts, you know, and it's come in waves, right? We have areas of the country that were very hard hit very early on. And so the natural thought was for many of those of us who were in the rest of the country that, well, we'll be okay. We didn't have to think about it, you know, glad we dodged that bullet, right? And even if your locality is not affected to the same level that our brothers and sisters in California, in Texas, in New York are dealing with, in Florida, we are all having to modify our lives in ways that very much feel like an imposition. You know? So we have wonderful buildings and space on campus that are now occupied by, like, you know, these huge tents. Absolutely necessary. You can't open up the door without some reminder that nothing is quite like it was just a year ago. So that builds in the background, and then one day you get a positive test, or one day somebody tells you that you have to go quarantine for 14 days, and it sort of just rushes back to you after you feel like, okay, I've got this under control, I can manage this, I have multiple, you know, I have kente cloth masks, I have Star Wars masks, I have, you know, like I
the surgical mask, I got the N95 from somewhere.
You know, I found a
songs for washing my hands too.
That's it. I found a fashionable hand sanitizer clip, right? It's like you do all the things that you think you need to do to protect yourself, and then you come to campus, which for many people is a place of safety, and you're reminded once again that this safety is a little more elusive than it used to be, and so. And this is all very natural, and yet it doesn't always help in the moment when you're dealing with it.
Well, and I think, you know, we've talked about this, I think, on other episodes, that the timeline for this, that kind of chronic nature of living through a pandemic is, you know, there's some expectation to I should be used to this, right? This should feel normal. It just doesn't, and it's not going to. Right. Kind of releasing that expectation of yourself, right? Like, why am I not used to this yet? Why do I keep forgetting my mask and have to go back and get it? And those sorts of things. That's all because it's not normal.
Right. Or why can't I just have this 2-minute conversation without my mask on, right? Like, you know, like there's little things that you were used to doing, and it's not normal, and if you're not feeling normal, that's okay.
It's okay.
It's okay. It's okay. And come and talk to us. Call the counseling center. You know, we're doing all of our appointments on Zoom, so we can all be safe and see each other's faces without our masks on. And we can really, listen to that, bear witness to how challenging this is, and then also work with students on ways to use some strategies to kind of manage the ebb and flow of that anxiety as it kind of peaks.
Yeah.
Right. I mean, I think if it's, if I have any advice for students is to be patient with yourselves and with each other. You're nervous and you're anxious, and other people aren't necessarily aware of it, or they don't necessarily acknowledge it, or they don't want to. Everybody wants to. This is a time of life when everyone wants to appear like they're okay.
Yeah.
And so, you're feeling like you're barely held together with bailing wire.
Yes.
And everyone else looks like they're doing so well, that their tan seems unaffected, their six-pack is now become an 8-pack, and like, what's happening to me? Like, I'm just not feeling so good. And I think all of our students have to unburden themselves of the need to act like they're home, right? So they have to unburden themselves of that need and reach out for help. And we can at least help them walk through what it is they're feeling. Just to remind them that, you know what, you're really not crazy. And in fact, no one really is. That's a term people throw around, but there really is no such thing, like there's no such thing as heart craziness, right? We call it heart disease, not heart crazy.
Right.
Right. So
exactly.
Stress is an illness. The feeling of stress it can be an illness, and
it's definitely a body wound.
And if you want to know how to help, reach out, because we're here to help.
Yeah, and one thing we
perfect advice, Dr. Commodore.
Really
I wanted to just pause for a moment and rest in what you said, because telling students that, having a student to just tell themselves really that it's okay that I'm feeling this way. We're living in an environment now that is just not the natural flow of things, and that it's okay to feel what I'm feeling. And it's okay to reach out and not try to act as though I'm okay. If this is the time more than ever, it's the time to say, hey, I'm not okay. I'm experiencing a lot of stress. And, before it gets to a point where it is highly, in high acuity or even chronic, you can come to see somebody. You're a phone call away from someone who can help you process or just sit with you while you talk about it, right? To be an empathic ear. And one of the things that I like to use the whole self-compassion triad with students, in terms of acknowledging that here is where I am now, in this is a state of suffering for me. I'm not okay, acknowledging that. And then pulling in a common humanity that everyone is experiencing this. So these other people that you're looking at other people's outsides and judging your insides by them. And so everyone is struggling in this moment. And so being a part of that common humanity can make students feel like, hey, I'm not alone in this, although it feels very isolating, right? And then giving themselves some level of kindness around what they're feeling, doing something small for themselves, whether that's listening to their favorite tune or going for a walk, or if they're quarantined, there's various activities around quarantining. You can, color or do something that makes you feel good in that moment, and giving yourself that space to just be really. To do that, I think is being compassionate with themselves is really a big deal, and you have to kind of keep doing that and pushing through, because these aren't natural times, I will say.
Right.
Yeah, and I think that self-compassion piece can be so challenging. I think many people are really good at generating compassion and sending it outward,
yes,
thinking of others.
But inflow is difficult.
really hard to turn it around. It takes practice and intention and attention to the self. And again, that's something that clinicians like us can really help out with, as far as guiding a student for how to do that and cultivate that sense of self-compassion.
That has been really helpful for me through this whole thing since March, is working with students around that. And it's been helpful for the work with students as well as teaching that. You know, I've seen people really learn to help themselves, right? Because that's the whole point of it, is helping people to find their own power and to find their own body agency to be able to move through. So yeah, I just think that everything that we're talking about is really, really helpful for helping through this time, because there really isn't, I mean, we're all kind of in this together, which is why I wanted to really bear witness and to sit with what you said, Dr. Commodore, because we all are in this together. So we all have to work at it.
I was just going to add, you know, we've mentioned it several times that if students are struggling, they should reach out, and they're a phone call away. I'm going to share information about how to reach the counseling center specifically, but to remind students that they can walk through any door virtually on our campus and find support. So if you're not sure, you know, where to go, you can check in with your academic advisor or check in with someone at the Center for Intercultural Life, or, you know, wherever you may find yourself, you know, you can get support there. And if those folks feel like you need other support, they'll direct you. But it's not a problem to go to the people you may already know and feel connected to ask for some support to begin. And then if something more is needed, maybe they'll send you toward the counseling center.
Correct.
Absolutely.
So, Dr. Commodore, is there anything else you feel like the community needs to know or hear from you before we switch over to looking at the resources at the counseling center?
Only that we are devoted to keeping the community safe. So that's one. And so if I'm stealing cookies, it's only because I want to make sure that we get to Thanksgiving, that we have a semester where students can have memories and joy and interaction and learning with their professors, that they can engage in the New Orleans community with the community service that our university is so famed for. So that is why we're doing what we're doing. Two, that at least certainly at the health center, we also want to remind students to please come in, get seen for your medical problems. We are doing everything we can to keep our environment safe. And so if you are a student with underlying medical conditions, you know, don't let those fall by the wayside because you're concerned about sort of the safety of the environment. We are doing everything we can to keep the environment safe, but we want to make sure that people come in for their vaccinations, for their flu shots, for their pap smears, for all the regular, ordinary care that they normally would need. Please come in and do that, because we don't want the rest of you to fall by the wayside because we are modifying our processes because of COVID-19. And I guess the last thing is that this is going to sound like a terrible analogy, right? But I'm going to try it out. So there is no pandemic like this in living memory that we've ever had to deal with in the age of instantaneous information, never-ending hype, TikTok videos, YouTube conspiracies. Like, we've never, ever had to deal with this. But human beings have dealt with these things before, right? And we have managed to learn and go to college and meet spouses and loved ones and have children and do birthday parties and do all the things that we've wanted to do before. We just have to do it a bit differently. So be a great citizen to your friends, wear your masks, do your hand sanitizer, but socially distance, bake a cake, make cookies for each other with good distance, send care packages to each other, send each other a note, like a plain old thank you note for something sweet that maybe a friend did. Do that. The act of doing it is wonderful, and getting it is great, because all I get now are bills, right? If I get a thank you note, it's fantastic. So I would encourage students to discover new ways of telling your friends and loved ones that you care about them, ways to engage with them, because that is, at the end of all of this, that is what I hope we all get out of it, that we need each other, and that we miss each other, and that we should tell each other.
Awesome. I think that's all that needs to be said. This has been great. Thank you so much.
You're welcome.
Excellent tips.
Let me share my screen for just a moment. I want to make sure we put some information up for everyone. Just a reminder about the Counseling Center's location. It did change over the summer, and so the Uptown Clinic is located now in the Diebold Complex near the Riley Center. The Downtown Health Center is also open at 127 Elk Place. We do have extended hours now at the Uptown Clinic, so by appointment you can be seen. I think the last appointment is 6 p.m., so they're open until 7. And like we said earlier, we're scheduling all of our appointments via Zoom, and those are same day, first time appointments. So when you call, these two lovely ladies on your screen, Charlesetta and Belinda, will place you on the schedule with a clinician for that very same day. So we can talk with you about what's going on in that moment and really help to make a plan for how we can support you. And you can do that if you're in quarantine or isolation or not, and just really, feel like you need someone to talk to. Don't forget to tune in every Wednesday for a new episode of Wellbeing Wednesdays. And if you follow us on any social media, you'll get reminders when the new episode is released. And if you subscribe to the Campus Health YouTube channel, all the episodes will be there. And I always try to finish with a little bit of humor, because that's one way to keep the anxiety level low, right? I think we all live in Zoom now, and this is the reality of Zoom land. So this has been wonderful. Thank you so much for taking the time, Dr. Commodore. We're so grateful to you and all the staff in Campus Health working tirelessly to keep us all safe. Yes. And keep us on campus. This is remarkable.
It's selfish too. We like being here. We like being around our friends and colleagues. So if the campus is open, we get to come to work and enjoy some of those enriching interactions that we need, just like our students.
Wonderful. Thank you so much. So we'll be back next Wednesday, and we'll see you all then. Bye. Be well.
Bye-bye.